give you an update for Friday, April. Hold on just a second. All right. We good, Sam? All right. We had the microphone off. Sorry, everybody. Kevin Henderson, Grayson County Judge Executive. Today is Friday, April the 24th, 2020. We wanted to come to you and give you an update on what's going on in Grayson County. And first of all, I want to remind everyone to do their 2020 census. Also, I'll go through these fairly quickly. We've been over them before, but I want to remind everyone about budget shortfalls that we're probably going to be having, and also remember Watson School Road Bridge is closed. And also the state has suspended all road projects for the next 2 months, so a lot of stuff going on and a lot of stuff changing daily that we're being updated on. So just be aware, you're probably not going to see any road projects. Of course, we don't know where this thing's going to end up at. But also remember National Day of Prayer at noon on May the 7th, and please, remember that. Also, elections. There was something that came out today. I'll just read you what we received, and this is a plan that the governor and Secretary Adams has come up with. Governor Beshear and Secretary Adams have determined a way to move forward with the June primary elections. At this time, we know the plan will include requesting absentee mail ballots, which in a process we currently use in Kentucky. So it'll be basically, well, if you vote absentee, it's probably going to be the same process. The requirements to request this type of ballot will be lifted due to the COVID-19. We will be sure to post information as soon as it is available on how to request your ballot and additional election information. The regulations are being developed by the Kentucky State Board of Elections, and they are consulting with Secretary of State Michael Adams. Grayson County Board of Elections will review this information once the regulations are approved to develop in best process possible under the current situation. I know a lot of you is going to have some questions about that. We don't have the answers. That's going to come out of the state, and if you've got any questions, I urge you to call Charlotte Willis. She's our Grayson County clerk, and I just spoke with her right before coming on, and they still don't know all the details, so give it a day or two and let's figure out exactly what's going to happen. But her phone number is 270-259-3201, and they're in there Monday through Friday. Even though the office is closed, the staff is still working. So I know that's going to be sort of a hot topic for everybody, but I mean, it's just we'll see what happens, and we'll go from there. So next on the numbers, everybody, we knew this day would probably come, that we'd see a elevation in numbers, and today is the day. And just to go ahead and let you know, we're probably going to have the same thing over the weekend, and so that's why we're going to go ahead and come to you on Saturday and Sunday as well at 3:30 the same time. But as of today, we have 17 new positive cases as of 2:30 this afternoon. One 93-year-old female is a Grayson Nursing rehabilitation resident. An 88-year-old female, which is a Grayson Manor employee. Next is a 101-year-old female, which is a Grayson Manor resident. An 88-year-old female, a Grayson Manor resident. And a 24-year-old female, which resides in the county but does not have anything to do with the facility and is isolated at home. Next, we have an 82-year-old male, Grayson Manor resident, a 75-year-old male, which is a Grayson Manor resident, a 59-year-old female, which is a Grayson Manor resident, a 72-year-old female, which is a Grayson Manor resident, a 95-year-old female, which is a Grayson Manor resident, a 60-year-old male, or excuse me, 60-year-old female, which is an employee of Purdue, which is based in Butler County. So it's a 60-year-old female, but resides inside Grayson County, so that's why we count that number here, because they do happen to work there. Next is a 97-year-old female, a Grayson Manor resident, a 93-year-old female, which is a Grayson Manor resident, a 80-year-old female, which is a Grayson Manor resident, a 45-year-old female, which is an employee of Purdue also. And that person resides inside Grayson County, so that's, once again, that's why that number is counted here, because they reside here, but they are employed for Purdue. Next is a 48-year-old female, which is just a resident of Grayson County and is isolated at home. And also a 56-year-old female, which is a resident of Grayson County and is hospitalized in critical condition. And so the next I'd like to go over with you, which that's 17 new cases that are positive that we have inside the county at different locations and at Grayson Nursing and Rehab. And also hospitalized patients, the 66-year-old that we had told you about yesterday that was in stable condition. Folks, this is how this can change so quickly, is the 66-year-old male that's a resident of Grayson County, which was tested positive back a week and a half ago, is now in critical condition and is hospitalized in critical condition. And 87-year-old female is from Grayson Nursing and Rehab, is a resident and is hospitalized and in stable condition. And there's a 96-year-old male from Grayson Nursing Rehab, and it is also a resident, and they are hospitalized in stable condition. Grayson Nursing and Rehab residents, all of those folks are in stable condition. If they are not hospitalized, they are isolated to the COVID unit, which they have prepared inside of the facility, and they are all in stable condition. And I've spoke with a couple folks that these are their family members, and I've had a couple of them text me and call me and talk to me, and they just want to thank the staff over there for, they're in a tough spot right now. They're in a really tough spot, and we just need to remember them in prayer, and we only by the grace of God will we not lose anyone else to this virus. So the numbers as of 4/24/2020, as of 2:30 this afternoon, total cases is 366 that has been tested in the county. Now we have 77. I'll talk a little bit about that. Negative, we have 246, and as of today, we have 43 positives and 4 hospitalized, and 5 of those have recovered and are out of quarantine, and we've had one death. And the Grayson Manor is actually doing blanket testing of all the residents there. And if that's not complete, Josh, do you know if that's complete today as of right now?
They
Okay. As of, they were still working on it this morning. They're testing, and I'm sure some of you all that have got family and loved ones in there that they have called you and talked to you, and they're doing blanket testing of all the residents inside the facility. So that's why our pending numbers has gone up. Be aware, we're probably going to get some more positive. It's going to be a rough weekend. So that's why we wanted to come to you Saturday and Sunday. But be aware, we was aware of this. We knew that if this got into a facility, any facility for that matter, it's so contagious, and it's just terribly contagious, and it's no one's fault in particular, and it's just extremely contagious. And we wanted and prayed that we would keep it out of these long-term care facilities, but unfortunately, it is here, and we're trying to deal with it. And we know Grayson Nursing and Rehab is trying to the best of their ability to deal with it as well. So, just to let you know about the blanket testing, they have done that. There is some staff members that's been tested, and the ones that have been tested have been symptomatic, and I'll let Josh talk a little bit more about that. That's sort of in his area. And but if you got any questions for Grayson Nursing and Rehab, please call them at 270-259-3676 and talk to Jeff, Julie, Melinda, whoever you can get over there, and talk to them. They're extremely busy right now. You know, the community sort of stepped up. I've seen where a lot of people's taking them things, and their spirits are down, but we want to remember them and lift them up in prayer and thank them for what they're doing, because like I said, those residents out there are all of our families. And I'll let you know that, and I told you before, that you're going to know somebody that has this. Well, I know a lot of people that have it now, and one of these positives is actually my family, and so my thoughts and prayers are with them. So I'm concerned as well, but I know that they're doing all they can do, and we just need to lift them up. So Josh, if you would please come up and give us an update. So Josh Emery, Grayson County Health Department.
All right. Thank you, Judge. So just to highlight, what blanket testing is, because we want to make sure that the community understands. Blanket testing, in the past when testing, first was initiated with this virus, you had to meet certain criteria to get a test due to the tests were so limited. We're blessed now that tests aren't as limited as they were. So in this case, we feel like we should do a blanket test, which means that that facility's testing both symptomatic patients as well as non-symptomatic patients. So that's just for them to get an idea of the rate of the spread and how many residents have been impacted, as well as they feel that in order for them to get a better handle on it, they need to know what they're dealing with. So all of their residents, whether they are symptomatic or non-symptomatic, are being tested. And so they really wanted me to convey to the community that just because so many of these people are coming back positive doesn't mean that they are severely ill. Some of them are not displaying symptoms at all. So that's something to keep in mind. And again, some of them are. So I also just wanted to say that, it's a difficult time. We knew that these numbers were going to increase, as the judge said, and we've been saying all along. However, I would like to encourage everyone just to take a moment and breathe and think about the journey that we've been on, this journey together. We knew we were moving toward an upward trend in these cases, and my message to the general public is this. It's not a time to be ugly, rude, mean, or judgmental. Now is the time to come together, work together, and fight the virus together. I truly believe that the outcome will be much better if we join together and lift others up, especially the staff of this facility. So let's focus on what we can do to help better protect our community. And at the end of the day, we get nowhere by pointing fingers and being divisive. To the families of Grayson Nursing and Rehab, I encourage you to stay in touch regularly, ask questions about your loved ones, and if you have fears or concerns, do not allow the flames of rumors and gossip added heartache. Go to the source itself and ask those difficult questions. So I've had a loved one in long-term care before, and I know how it is to want that person to be protected. And based on what I'm being told from Grayson Nursing and Rehab, they're doing everything they can to do that very thing. I would also remind people that if you're a CNA and you can help Grayson Nursing and Rehab during this difficult time, they sure could use your help. So if you have that feeling that you want to do something for your community and help this facility in need, please reach out to them, reach out to Julie or HR there and let them know that you're willing to come and assist. There was also some questions yesterday about why some of the nurses at the health department do not go to the facility and assist, and that's because we're still operating WIC and hands over the phone, and some of our nurses actually even helping hands. And then we also have nurses that are running the operations center, so they're the ones that are doing the tracking and the notifications. And I had nurses at the department last night at 3 a.m. in the morning. They were there working, so they're working very hard. If they could go over themselves and help, they would, but their purpose right now is to track this virus and to make sure that we're keeping an eye out on the numbers. So just to update people on the health department itself, the health department is going back to being open to the public on May 15th. However, we will operate much differently than we had been prior to this virus. We will be operating by appointment only. The lobby will remain closed, and patients will have to wait in their cars until they're called. We are installing a plexi guard, like 5 Star and Save-A-Lot, some of the grocery stores you've seen, to help protect our registration clerks from droplets. All group support meetings and trainings for May have been canceled, and hands will continue operating via phone as well as WIC. And we will review the process around June 1st. Before I came up here, there was also a question someone had asked about why PPE, gloves, and masks have not been sent over to Grayson and Manor, and that they have families at home. And as I've said in prior updates, the health department has sent over several items along with the state, and it was my understanding, I was on a call today with Grayson Manor as well as Kentucky Department for Public Health, and Grayson Manor had reported that some factories had donated some gloves and some face shields. So I'm sure those items will be delivered very soon, but according to Grayson Manor, their PPE storage is it's acceptable right now, so they have everything they need. The last thing I'll say as far as state numbers is 42,844 people have been tested in the state. Out of those numbers, 3,481 have tested positive, with 191 deaths. Do you have the map up? Okay, so on your screen you will see the map of Kentucky that shows the spread of this virus. You will probably see within the next few days that Grayson County will go from a dark orange to red, indicating that we do have spread. And according to these numbers, that's absolutely truthful. So don't be alarmed when you see that. It's something we're aware of, and we know that we're moving in a new category, a new territory. But like I said, now is the time not to be divisive, but lift everyone up and try to help others in need. Instead of being negative, reach out to a neighbor and see if they need anything, or reach out to some of these loved ones who have family members in Grayson Nursing and Rehab and see if there's anything you could do to make this difficult time a little bit more easier. Thank you so much.
All right, what was that one question on there, Sam? There was a question that came up about employees over there and going home to their families. I mean, some of y'all might have missed the last briefing or the past 15 or 20 that we've done, but any of the staff that is over at Grayson Nursing and Rehab, if they're in a situation that they can't go back home to their families, we've got facilities for them to stay at. Matter of fact, we've got 3 operating right now, and Grayson Nursing and Rehab has got 1 that they're sending their COVID nurses to, that's taking care of that wing where they can get some rest. So look, folks, everybody's doing everything they can possibly do, and we're working with them and their board, and all the direction we're getting. Understand, this is not our decision on what we're doing. We give suggestion, and we're getting this from the State Board of Health and some of those folks up in Frankfurt. So whenever you talk about why aren't you testing these and why are you testing this one, because that's where we're getting our direction from. Whether you agree with it or not, that's totally up to you. But right now we're having to listen to them because they're in the business of trying to knowing the best thing that they can possibly do for the community. Could it change? Absolutely. This thing's changed every day as far as I've seen ever since all this started. So if you're quick to get on and criticize some of the staff over there, staff anywhere for that matter, I suggest that you throw in and pony up and go over and try to help them folks instead of trying to criticize them on Facebook or on the internet. So I can't imagine what they're going through right now, and especially some of the families with some of the residents over there. So let's all remember them. We're going to give you any kind of update that we've got. I know a lot of people still got a lot of questions. Quite honestly, folks, we've got a lot of questions. We call the state. We're in contact with them 2 to 3 times a day, and asking them what can be done in different situations. And just like the testing that they're talking about right now, the reason we're seeing elevated numbers is because we're testing more, of course. So it's not that it's okay. 4 weeks ago it wasn't here, folks. I told you before, it was here. It was here. People wasn't sick, and some of the younger folks could have been carrying it around and not even knew it. Some of these folks that has recovered didn't even have symptoms, and they got tested because they had a sore throat and thought they had strep throat or just something, and that's all they had. It wasn't like they was extremely ill laying in the bed. So sinus season's going on right now. It's hard to determine whether you've got sinuses or this. So our suggestion, as it has been through this whole process, is to contact your healthcare provider. Tell them what's going on, and they will get you. If they think you need to be tested, they will even send you through the drive-through testing facility over at the hospital that they have set up, where you have to have an actual order from the doctor to go through that facility, and which I don't think it takes for. Josh, how long have they said it takes? Not very long. Yes. 10 minutes. 10 minutes you're in and out of there. So, and hopefully we get to a point, hopefully the state ramps up a little bit, a few numbers, and we can start testing everyone and getting everyone tested. And hopefully we get to that point. But folks, I'll be honest with you, we're just not there right now. They might be in Fayette County and Jefferson County, but they're not here in rural Kentucky. So anyway, if we'll be back with you again tomorrow to update the numbers, but folks, I want to go ahead and warn you, don't be alarmed. We're going to have some more positives. So everybody just continue to pray for them folks over there, and because like I said, it's only going to be through the Lord's good graces that we get through this thing without losing another resident or anyone in Grayson County for that matter. So everybody just stay safe, have a great weekend, and God bless.